Hi, this is Dr. Edmund Tai. I'm a medical oncologist, hematologist. I've been in practice for about 30 years in the United States. I want to talk a little bit with you about multiple myeloma. This is a condition that's actually relatively common and becoming more common as the awareness of its existence lead people to look for it. Typically, patients will present with any number of symptoms. Most common is bone pain, anemia, and other occult infection. And we find then, because of blood tests, we find that they are pancytopenic or they have renal insufficiency. And then further testing looking at total protein and albumin will indicate a high total protein level. And usually the suspicion is what leads to the diagnosis. Oftentimes we also see bone lesions on plain X-ray films. These are what we call lytic bone lesions. They look at holes in the long bones like the humerus, the femur, and the pelvis, and the spine is often affected as well. This disease has come from plasma cells that have decided to become abnormal. And what happens is that they will produce a M protein, which is a defective antibody. And this antibody is actually the toxin. It would damage the kidneys, the nerves, suppress the bone marrow. Those are the major side effects that you would see with multiple myeloma, and which is always a difficult disease to deal with in the past. In past, we deal with symptoms as they appear. So someone who's anemic, we have to transfuse. Someone have bone pain, we have to do the radiation. And in the past 10 to 15 years, we've been giving chemotherapy of various types. In the old days, the chemotherapy was not as effective and it's quite toxic, and which limits use. The standard treatment, melphalan is usually not used anymore due to the potential to causing leukemia as well as lack of effectiveness. More recent years, we use the Decadron associated with Revlimid, or Decadron plus bortezomib, or Decadron with both of those drugs. This is called this is considered fairly standard first-line treatment for multiple myeloma. Unfortunately, nobody goes into complete remission, and everybody progresses eventually, usually within a few years. And so up to now, we really do not have what we call drugs that are capable of curing patients. So people have gone to bone marrow transplant, usually autologous bone marrow transplant, which would usually put people in a remission for a brief period of time, usually 1 to 2 years, but then they will relapse again. It's almost a guarantee. So this drug, daratumumab, is a major breakthrough. It is an anti-CD38 antibody, and it basically attacks stem cells, and almost all multiple myeloma cells would exhibit CD38 at some point, and therefore that's why this drug is so effective. And the drug is relatively easy to give. It's an antibody, and it's given with a loading dose over 4 months, followed by maintenance dose until disease progression. So this treatment is able to put people into progression-free survival for at least 12 months. That means for 12 months there's no progression. That is the average. So half the people do much better than that. And we have very high response rate and quick response rate. Most of the response occur in the first month, and usually the maximum response is reached at about 5 months of therapy. And then after that, the maintenance therapy will keep you there. Interestingly enough, this drug actually lasts quite a while, much longer than just the infusion. It lasts as long as 6 months after the last infusion. So that's why it's, as with many antibody treatment, sometimes the side effects as well as the effect do last a lot longer than we think. Of course, as with any cancer, resistance is a problem, and patients do develop resistance to this drug as well. But at this point, this is the best treatment we have to offer. Whether we give it by itself, in conjunction with bortezomib, or with Revlimid, or with other agents in the future, remains to be seen if there's any advantage. But it's effective in all 3 settings. So this will give us another tool in the ongoing treatment of patients with multiple myeloma to extend people's lives significantly. Thank you.